Hello. I'm sorry I can't be with you in person today. During my time as director of the US CDC, I really enjoyed supporting the FETP program and interacting with participants. Thank you for your commitment to this program and for committing to improve public health in Nigeria. Resolve to Save Lives is a global public health nonprofit focused on two areas: reducing deaths from heart disease and preventing epidemics. 3 out of 10 deaths in Nigeria are from non-communicable diseases, and that number is expected to rise to half by 2040. 1 out of 4 Nigerians will die before age 70 from a non-communicable disease. These deaths don't need to happen. The cardiovascular health program at Resolve to Save Lives focuses on 3 interventions to reduce preventable deaths from heart disease. And we have a riddle to explain our strategy. When does 50 plus 30 plus 0 equal 100? By improving global control of blood pressure from 14 to 50%, reducing global consumption of salt by 30%, and completely eliminating artificial trans fat from the food supply, the world can save 100 million lives over the next 30 years. There's growing global momentum to address these 3 areas, and the World Health Organization has included these areas in their 5-year work plan, setting goals to achieve a 20% relative reduction of raised blood pressure, 25% relative reduction in salt intake, and their flagship Replace initiative, which aims to eliminate industrially produced trans fat and make the world trans fat free by 2023. High blood pressure is the leading cause of death worldwide, causing 10 million deaths each year, more than all infectious diseases combined. It's known as the silent killer because it usually has no symptoms, but causes debilitating damage to your brain, heart, arteries, and kidneys. Most people with high blood pressure don't have it controlled. Just 1 in 7, or about 14% globally. The data aren't completely clear, but we believe that the control rate in Nigeria is approximately 5% or less. There's increasing interest from countries around the world, including Nigeria, to address the burden of high blood pressure. There are 5 essential components to effective hypertension management. First, establish and agree to a protocol that standardizes treatment. That protocol should be drug and dose specific, with a schedule for titration or addition of medications when patients' blood pressure is not controlled. Programs around the world have learned that using a protocol eases logistics, training, task sharing, and procurement, and most importantly, substantially increases the number of patients effectively treated. Second, medication supply should be consistent. Selecting a protocol helps with medication supply by standardizing the medicines needed and the amounts needed and helping to reduce the unit costs. Third, involve the community. Incorporate non-physician health workers into hypertension treatment. Health workers accessible to patients can provide and, following physician orders or protocols, adjust and intensify medicine. Fourth, make the patient the VIP of the program. Patient-centered services reduce barriers to adherence. Examples of these services include reducing costs for medicines and medical visits, ideally to 0, increasing convenience of medical visits and medication refills, for example, having them once every 3 months, using once-daily treatment regimens, fewer tablets, including combination pills, improving access to blood pressure monitoring, including in public places, and increasing awareness of the importance of blood pressure control. Fifth and finally, information systems. What gets measured can be managed. Real-time feedback improves follow-up of patients who are not under control and measures program quality. It's crucial that there's continuous analysis and use of program data to improve patient care. In addition to hypertension control, there are 2 nutrition initiatives that we're pursuing to reduce deaths from heart disease. Trans fat is an artificial chemical used to increase the shelf life of food, but the cost is a decrease in human life. Trans fat has been linked to 500,000 deaths each year. True tragedies because trans fat can be replaced with healthier alternatives without changing the taste or cost of food. In 2018, the World Health Organization launched Replace, an action package that provides governments with the tools they need to remove trans fat from their food supply. WHO set a goal of global elimination by 2023, and we've seen rapid acceleration in the number of countries taking steps to replace trans fat in their foods. In just the past year, Thailand banned trans fat. The European Union enacted regulation to ban trans fat by 2021, and more than 40 countries began trans fat elimination activities. In Nigeria, the Permanent Secretary and Acting Minister of Health signed a formal letter of commitment to eliminate trans fat from the food supply in Nigeria, and the technical working group is active and paving the path to elimination. The other nutrition initiative addresses excess salt. Approximately 1/3 of all hypertension is attributed to excess salt consumption. Nearly all people worldwide eat more than the WHO recommendation of 5 grams of salt per day. We've learned about recent best practices in salt reduction from Chile, South Korea, the United Kingdom, and elsewhere. These best practices include front-of-pack warning labels for high-salt foods, interventions that address restaurants and vendors, and behavior change campaigns. Depending on the source of salt, reformulation by industry, food procurement policies of the government, and promotion of low-sodium salt substitutes are other successful interventions. Data on sodium intake and nutritional sources of sodium in Nigeria is currently unavailable. More information and resources, as well as access to catalytic grants for NCD projects, is available on our new platform for the global cardiovascular health community, linkscommunity.org. I'm often asked what people should cook with at home in terms of oils. There are lots of healthy oils out there: sunflower, safflower, soybean, mustard, and in Africa, groundnut or peanut oil, canola or rapeseed oil. All of those are much healthier than the alternatives. And in terms of sodium, you can see what it is in your diet that you can change and shift to the low sodium salts, which are much healthier. Now, shifting to another pressing global issue, preparedness for epidemics. The 2014 Ebola epidemic taught us that the world is not ready for a global disease threat. Our world is increasingly interconnected. It takes just 36 hours for a disease to spread from one country to anywhere else in the world. Not being prepared can cost lives. In 2016, the World Health Organization launched the Joint External Evaluation, or JEE. JEE is an independent, transparent assessment of a country's ability to find, stop, and prevent public health threats. Since 2016, more than 100 countries have undergone the JEE process, which has identified more than 7,000 life-threatening gaps in preparedness. The African region has completed the most JEEs. More than 90% of countries have done an assessment. This commitment to assessment is really impressive. Unfortunately, the results show that there's much work to be done, and there's been much less activity filling the gaps that have been identified. We need to shift from assessment to closing gaps. Countries need to focus on stepping up to preparedness. Using data from the JEE, we focus on incrementally improving preparedness in 4 core areas: disease tracking systems or surveillance, laboratory networks, training and supporting disease detectives, and developing rapid response teams. Cross-cutting capacities are also important: improved legal resources for preparedness and preparedness policies, as well as improving risk communications. According to Resolve's ReadyScore, Nigeria is not yet fully prepared for an epidemic. There's been tremendous progress in just a few years, including completion of the National Action Plan for Health Security and efforts to establish a functional laboratory network for yellow fever, measles, and rubella. These and other preparedness efforts were achieved while dealing with a constant stream of outbreaks, including Lassa fever, monkeypox, yellow fever, meningitis, cholera, and measles. It's not easy to step up. It's going to take time and requires continuous funding. It's much easier to get funds for disease prevention when you're dealing with an outbreak. When the outbreak recedes, so unfortunately all too often do the funds. But we know that epidemic prevention is smart spending and can be done for about $1 per person per year. The World Bank has recently increased their commitment to preparedness spending, and we're hoping country governments will do the same. In closing, I want to leave you with one fundamental point. FELTPs are essential because data are essential. Data to know if we're making progress. Data to fix problems if we're not making progress. Data to defend programs that are succeeding. The NFELTP played crucial roles in both polio eradication and in the control of Ebola in Lagos. I hope that, in the coming years, it will play a similarly pivotal role in cardiovascular health and epidemic prevention more broadly. Thank you for your time. Best of luck, and I look forward to learning from the great work you're doing.